Hey, folks, I hope you're having a fantastic day. You know what this is? It is a podcast. My name is Chuck Tuck, and this is Amazing People, Amazing Things. Today's guest is Dr. Andrew Kadar. He is an anesthesiologist and the author of the book, Getting Better, A Doctor's Story of Resilience, Recovery, and Renewal. Today, he's going to discuss his personal experiences with heart disease and the importance of really recognizing and addressing symptoms. He emphasizes the need to listen to our body and seek medical attention when necessary, even if we don't fit the typical risk factors. But Dr. Kadar also highlights the importance of balance and being proactive about our health and avoiding unnecessary paranoia. So please sit back, listen, and enjoy this podcast. And remember, if you're a pet owner, please be responsible and have your pets spayed or neutered. All right, let's get into it.
Welcome to Amazing People, Amazing Things with your host, Chuck Tuck.
You were quite the athlete, and you do have a book that you authored that's called Getting Better, A Doctor's Story of Resilience, Recovery, and Renewal, because tragedy struck you as far as medical stuff, right?
Yeah, it was quite a shock to me because I'd been athletic. I was on the UCLA gymnastics team when I was an undergrad. I continued to stay active. I ran lots of 10Ks. And one day I was working out in the gym. I was doing a pretty vigorous exercise on the elliptical, and about 9 minutes into it, I started feeling a little burning in the center of my chest. Now, I knew I didn't have heart disease, so I wrote it off. But 3 days later, I'm back in the gym. Same thing happens again. This time I wait, start up again. Again, it happens. So then I think to myself, okay, although I know I don't have heart disease because I'm very healthy, what would I tell anybody else who had these same symptoms? And then at that point, the answer became obvious. And I think that's kind of the first lesson to me, was that the best way to get over denial, which is very common with lots of diseases, is take it away from yourself. What would you tell anybody else who had the same symptoms? And then you can be much more objective. Because when it's about you, you don't think the same way.
Yeah, and you use that word denial, and so many people do that. But I think also now with the internet and being able to research, so many people are the opposite as well. They start researching, going, oh my gosh, I have this. I'm like this way. So you've got what I'll say the hypochondriacs, and then you got the folks who are in denial. But perhaps, I don't know which is worse, but we'll talk about the denial because I am one of those. Why do we deny these things? Why are we in denial when it comes to our own health? But when we look at somebody else, we tell them, hey, you don't look good. You got to go check it out.
Yeah, it's much easier to be objective when it's not your own self or somebody you love. And I think that's very common. And there are lots of stories of pretty dramatic denial. I mean, people ignoring somebody running around with a gun because it can't be real, or people have walked into burning buildings because they just can't believe that what's going on. There's a famous episode in one of the London Underground subways where people were running out of the station and others were still boarding the train because they just couldn't believe what was going on. And I think in a lot of medical situations, you don't want to believe what's going on, and it's unlikely in your eyes. So, this little lump that I have, it's not so hard, it's not so big, it'll probably go away, and then sometimes it grows. But I don't want to stir up a whole lot of paranoia either, because it's a balancing act. Yeah. Every headache is not a brain tumor. The vast majority aren't brain tumors. The vast majority go away with very little intervention or no intervention. So it's very much a balancing act. But what I had was chest pain that came on with exercise, was relieved by stopping the exercise promptly, and that's pretty much diagnostic of coronary artery disease, which is what I had. So I should have known better. but really, you should know better. Everybody should know better because everybody knows that's really what signifies the most common presentation of heart disease.
So it's almost seems, I'm just going to use that word, counterproductive, where we're trying to do certain preventative medicines, exercising, but sometimes we vigorously exercise to the point where it's too hard on our bodies, and then we cause some of these issues, but then we are in denial because of saying, hey, I'm working out hard so I don't go through this stuff. How do we change our mindset about being able to take care of ourselves, not only, physically strength wise, but the internal organs and stuff like that of our bodies? Because you were in
Well,
denial.
yeah, I mean, I don't want to tell people not to exercise because even after you have heart surgery, you should exercise to get yourself back in shape. So that's generally a good thing to be doing. But if you're having symptoms, then you got to listen to your body.
Okay.
And 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 obviously there are people who overreact and become paranoid and become hypochondriacs basically. And again, as I said, it's a balancing act. You don't want to ignore the obvious, but at the same time, you don't want to overreact. So, and I think you can avoid both of those by asking yourself, what would I tell somebody else? You wouldn't tell somebody with a headache to immediately go get a brain scan,
Right.
but 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 you at the same time, if it persists, you wouldn't want to ignore it either.
Yeah. And like I said, it's a fine balancing act. And I would imagine that, taking a situation like you, where you were an athlete, you were working out, you tend to think that you can overexert and work harder. But I would again imagine that most people, um, before you get into immediately working out really hard and strong, a vigorous exercise, start out slow, and then if there are any signs, like you said, you're having shortness of breath or something like that, back off on your exercise. Would that be a good way of kind of gauging things, or?
Yeah, I think you have to gauge how you're feeling.
Hmm.
And actually, the first time when I had the chest pain, I thought, okay, I'm going to stop now. I no sense in pushing on when I don't feel well. I
Yeah.
didn't think it was anything serious. I just felt that there's no sense in pushing on when you don't feel well. And obviously, there are. I mean, one of the famous examples is I don't know if you remember Jim Fix, the guru of running, the joy of running. I think he wrote a book and was a kind of a guru for jogging. He was sort of helped set that trend, and he ended up dying by the side of the road on one of his runs.
And we're talking about this where people are fit, but they end up having these, this is probably a word I'm just making up, cardiological um, issues with circulation and with the heart and things like that. Because I know several people who were in shape who had massive heart attacks, strokes. One in particular just dropped off and died in the at their work site. But he was in really good shape. So again, it could take any one of us at any time. Um, what is a preventative medicine? I know we talked a little bit about exercise, but what is a preventative medicine? Is there such a thing?
Well, there are things, but there's no 100% guarantee because I didn't have the usual risk factors. I never had high blood pressure. I wasn't overweight. I never smoked. I was essentially doing all the things you're supposed to do. I was health conscious. I'm a physician. I was taking good care of my health. On top of that, I had a good family history. My father lived to be 94. He was hiking with me in the Canadian Rockies when he was 86. So there was no reason for me to think that I was going to have this kind of a problem at the age that I did. But when I started having symptoms, I didn't listen the first time. but I listened soon enough to get out of trouble.
Yeah.
And and in Jim Fix's case, he was doing an article on a Boston marathoner, and he was in a clinic where they offered him an exercise tolerance test, and he said, "Nah, don't need it." And that could have detected what he had. Now after I I had the second episode, I called my doctor and had a stress test, and on that, I looked over and I saw the ugliest electrocardiogram I'd ever seen. It was just showed abnormalities everywhere, and then I had an angiogram, which I thought was going to just be a balloon angioplasty, but it turned out to be uh, triple vessel disease. So it's three vessels involved, including one that couldn't be bypassed, couldn't be uh, fixed with a balloon. So I had to have an open heart surgery.
Right. You had a triple bypass surgery, correct?
Mm-hmm. Yeah.
This also, I'm going to jump ahead, and if you don't mind, we'll jump around a little bit because you had your triple bypass surgery. Many people go through and they have some sort of bypass surgery. Now, after the surgery, I would imagine could be just as important as it was, preventative to exercise or to do something for recovery. What was your road to recovery?
Well, I think that what I was told is that 6 weeks after my surgery, I should go to cardiac rehab. I think it was 6 weeks. And so I started with cardiac rehab. And actually, in my case, they were very, very cautious. What is you exercise and they check your blood pressure and your pulse rate and see if you have any symptoms. I actually was doing more on my own than I was doing in the exercise in the rehab. So sometimes in my case, I think they were slowing me down. So what I say in my book is I converted it to a physician monitored exercise program with me being the physician. But essentially anybody else can do that too, because it's easy to get a blood pressure cuff that just automatically records your blood pressure. You can get a pulse oximeter that records your oxygenation and your pulse rate, and those are all very readily available in your local drugstore, through Amazon or what have you. And so people can monitor themselves. So long as you're feeling well, I think you can do a lot of it on your own. But in a cardiac rehab gym, you have nurses, you have doctors nearby, and that's helpful initially. And I did that initially, and then as I got further along, I did it on my own.
I'm glad you mentioned the fact that folks go out there and buy blood pressure cuff and things like that, because I do that as well. I've again, we're not here to put frighten people and to cause them to become more of a hypochondriac or whatever it might be, but it is good to know. Don't wait every 6 or 12 months to get these checkups. It doesn't cost you that much money to go out there and buy one of these things, just to be on top of it, right?
Right, and you can check your pulse rate and then see if it's regular. In fact, I think a lot of these smartwatches, like I have an iWatch, it tells you, it can tell you if you're in atrial fibrillation, for example. So there are lots of very easy monitors that people can have on their own. Obviously, if you see an abnormality, you should contact a doctor and see what needs to be done about that. But you can monitor yourself along the way as you're exercising.
Can I put you on the spot and ask you this? And we'll just say this is just a conversation rather than professional advice. With physicians and patients, over the years, it seems and sounds like that all of a sudden I hear more people saying, "Oh, I've been told I'm pre-diabetic. Oh, I've been told I have AFib. Oh, I've been told this. I've been told that." It just seems like things have compounded. But you go, "Well, what's your A1C or what's your blood pressure?" And you go, "Well, let's say that was normal." But then also on the flip side, it seems like every several years they lower the number. Again, with maybe type 2 diabetes, it used to be, say, you're 120. 120 for your glucose is good, and then it goes to 100, then it's 80, then they say, oh, now it's got to be at 75. You're going, well, wait a second. Who do we believe?
I think as data, you know, medicine is an evolving art. And as new information comes out, sometimes the data changes and the advice changes. There are some things that, you know, for example, with diabetes, it's basically considered to be a spectrum. So pre-diabetes is basically a tendency towards. And perhaps do some things to keep it from developing along those lines by watching your diet. Now, there's a lot of controversy about what's the ideal diet and how to manage that, and that really is more an endocrinologist job than mine. I do anesthesia. I put people to sleep and I wake them up.
Yeah, that's why I didn't want to put you on the spot, but I thought, you know what, I'm just going to ask this. But
you know, with high blood pressure, what the data that's come in is that above a certain level, there's a greater tendency to have cardiovascular problems. So although it's over 140, it's worse, but even from 130 to 140, it's a little worse than if it was under 120. So as the data comes in for that, the recommendation is to try to have it lower. But it's a fine balancing act there too, because if you take medication that can have side effects, then that may outweigh the beneficial effects. And that's really on an individual basis. And that's not something that can be discussed in general terms for anybody in this kind of a setting.
And yeah, using blood pressure for an example, I remember going into a doctor's office. I literally, it was 80 something degrees. I ran inside and I sat down. Within a minute, they put that on and they go, oh, you've got high blood pressure. And I said, wait. I just ran in here. Can we do it again? And things like that will make a difference, right? Even if you're at home and checking your blood pressure or whatever it might be.
Yeah, exercise raises your blood pressure.
Yeah, so we've got to watch out with that.
Your blood pressure is going to be higher if you just ran a mile.
Yeah, right.
A brief period of time.
Mm-hmm. It also sounds like to me, because like you said, the medical field, they're gathering data. So I look at this as a science, and science just means you gather data and then you make a determination from there. And more data changes, the outcome could change. So this is not an exact thing. If, as that example I was given, where how come it's going from 120 to 100 to 80? It's more data is being gathered and new information is being reviewed and put out.
Yeah, and of course, high blood pressure and heart disease has been around for a long time. But we had when COVID came along, data was changing very rapidly because we went from a brand new disease that we knew nothing about or very little to with experience knowing a whole lot more about it. So it depends, but for heart disease, there's lots and lots of data at this point.
Yeah.
It's kind of the number one killer for a long time now.
Right. Well, Dr. Kadar, your book, Getting Better, A Doctor's Story of Resilience, Recovery, and Renewal, what was the purpose of you writing this book? Was it just to release something from you, or to help people, or what was the reasoning behind this?
As I was recuperating, I realized that I learned quite a bit from this experience. And I thought that telling other people about it would be helpful for anybody facing a major medical crisis. Initially just for heart disease, but then as I thought about it, really for any medical crisis, because there's a lot of overlap. And I think, for example, overcoming denial, that has general things. But when you're recuperating from a major surgery, one of the things I learned is to expect the unexpected. Things come up that you weren't really expecting. I mean, when I was in college, I thought that doctors routinely exaggerated the amount of time it took to recover. Because my friends were guys on the gymnastics team, and they'd get back to the gym in half the time they were told it would take to heal. And I thought, oh, they routinely double it. Then I got to medical school and I realized, no, that's not the case. I just had a not a standard sample. I had a sample of highly motivated young athletes who wanted to get back to the gym, and so they got better faster. So but in my mind, I'm still that guy. So I figured I'd recover the fastest anybody ever has after open heart surgery. And it didn't turn out to be quite that way because I had a bunch of complications that I wasn't expecting, and some were surprised. Well, several were surprising to me. For example, when you have drains in after the surgery to allow accumulated fluid and blood to leave the body, and those can cause some irritation in the diaphragm, and that can cause hiccups. Well, as the drains come out, there should be fewer and fewer hiccups. In my case, I had started with 4 drains, and as each drain came out, I had more hiccups. Finally, when the last one came out, it was like an attack of hiccups, like you can't believe. And when I was in medical school, I read about hiccups, and they're usually a minor nuisance, but they've gone on for months and years. And some people have even died of respiratory failure when their diaphragm became exhausted. Killer hiccups sounded like the attack of the killer tomatoes to me when I was in medical school. But when I started having these hiccups on top of hiccups on top of hiccups that went on for a day and a half, I wasn't laughing anymore.
So you're literally talking about a hiccup, and not just hiccup like a little mistake then.
No, I'm talking about hiccups, yeah.
Wow. So
that went on for hours and hours, and it would start off with one hic, and then another, and then a whole bunch, just a barrage of them, and then it would stop, and I think, okay, maybe it's over, and then one hic, another hic, and then a barrage again, and it just kept on going over hour after hour.
wow. Okay, so I have. Not that I've known or know anything about, open heart surgery, bypass surgery, things like that, but I had never heard anything about that. So, I mean, there it is. There's one of those, wow, never knew moments for me about what you went through.
Well, most people aren't going to have that, and I wouldn't have been surprised by a little bit of hiccuping, but I was totally shocked by the barrage, the total overwhelming. It was all I was doing was hiccuping.
Aside from the post surgery hiccups, is it safe to say that post surgery take things slow and easy, and don't jump right into being back to your normal self?
Well, you really can't be back to your normal self right away, and along the way, basically, there's always one symptom that's bothering you the most. Right after surgery, it's going to be pain. Because initially you wake up and it's, oh my God, I can't believe it hurts so much. But that lasts for maybe a day or so. And then after that, various other things come into play. At one point for me, it was, I also had inability to swallow. I had difficulty swallowing. And that, again, happens. Most people don't have that problem. I was unfortunate enough to have it, and I couldn't eat. Solids were near impossible, and liquids were difficult, and that took a couple of weeks for that to go away completely. So there were now again, everybody's an individual, and I don't want to let people think that if you're going to have heart surgery, this is what's going to happen to you, because chances are it won't. That's what happened to me, but you may have other problems.
So let me ask you this. How is it for you mentally? Because to me, it seems like if I went through a situation like this, it would really affect me mentally. It would scare the crap out of me, and I don't know how I would handle it mentally. So how was that for you? What was the process mentally?
An illness like this kind of messes with your self-identity. My self-identity was I was a superbly healthy individual. Well, that got shattered pretty quickly when I couldn't move without hurting. Your self concept gets changed quite a bit when you go through something like this. It also gives you a lot of time to think because you're out of your normal life. I had a busy schedule. I'd be in the operating room by 6:30, 6:45 in the morning, and depending on the lineup, I could be there mid-afternoon or late into the evening, and that's not even accounting for night call. So all of a sudden, I had essentially 12 weeks off, and so it gives you a lot of time to reconsider and evaluate your relationships, evaluate what you're doing with your life. So yeah, it's definitely a life-changing experience when you go through something like this.
Well, this makes me think about a situation, not a situation, but something that we should all consider doing sooner than later. You need to have your affairs in order for just in case something like this happens. And if you don't make it out 100%, or you make it out, but you are only 20% there. And what I mean by have your affairs in order financially, what direction you want to go, DNRs, things like that. Would that be a good statement to make, to be prepared?
Yeah, I think that's probably prudent for everybody. Now, the very first time I made out any kind of a will, and it was very informal, was just before I went into surgery because I never thought I needed it. I mean, I'm too young, too healthy, who cares? But at that point, I thought, okay, maybe I better just write a few things down.
Yeah, you don't want the state or somebody else to take it.
Yeah, you want to have some say over what happened.
Yes, exactly. There's so much that needs to be considered pre and post, I think, with this situation. And it sounds like your book is really going to go through your story, how you dealt with it. But I think, as you've been saying throughout our conversation, everybody's an individual. We may experience things differently and react to things differently, right?
Right, but there are a few things that everybody that applies to everybody. I mean, I think one of the things is expect the unexpected,
Okay.
and your outlook is going to change on your self evaluation and how you see yourself relative to others. You also see, in my case, it brought my wife and I closer together because she was very helpful to me, and I admired the way she helped me, and she admired the way that I was recuperating and kept focused on getting better. I think when you have problems along the way, the best way to tackle it is what's the problem and how can I get over it.
Yeah.
And so I had that attitude throughout, and I think she respected that, and so we had more time to be together actually as well. So all those things that an illness like this can ruin your relationship or enhance it.
Well, yeah, and as you said a little bit earlier, is it gives you time to reflect. It gives you time to slow down, because in today's day, in these days and times, we are all in such a hurry to get to something, someplace, so quickly, without stopping to think or look around. So, I guess this is the good out of the bad. It gives you that time to reflect.
Yeah, it definitely puts things in perspective. And I suppose if you're smart enough, you can take that time without getting sick, and I'd recommend that.
Well,
But
oh gosh. Well, Dr. Kadar, I mean, there's a lot of great information that you're giving us on right now, and where would people go to find your book or to know more about you? A website or something like that?
Yeah, I have a website. It's called gettingbetterdoc.com, and it's those words, gettingbetterdoc.com, so DOC at the end. And of course they can get my book. It's available in some bookstores and obviously available on Amazon, which is where everybody goes these days.
Yeah.
Morehouse's website, that's my publisher, their
Okay.
website also.
Wow.
You can order it there as well.
Um, this is
But what I,
fantastic.
but my goal is to make it easier for people who are in a similar situation, facing a medical crisis, and also for their loved ones, because it it changes it changes them as well. I think uh, part of the book, there are several sections in the book that are in the voice of my wife, and how it affected her.
That's good because your illness, my illness, your individual illness affects those around you, and they need to. I would imagine that they also need to feel comforted somehow or acknowledged for what they're doing or whatever it might
Yeah,
be. They feel pain or something as well.
yeah, and I think it's a strain on them, and they have to do things for you that otherwise they didn't have to. And there is a thing, caretaker exhaustion syndrome too, where it just gets to be too much. So, for example, um, once I got out of the ICU, one person can stay with you overnight. And so the first night out of the ICU, my wife decided to stay with me. Now, the hospital provides a little thin cot. I guess it's kind of like a military cot. It's metallic, not particularly comfortable. And with the noise of the hospital and people coming in to take blood early in the morning, she didn't get any sleep at all. So after that, we decided she'd be better off going home, getting some rest, just not just for her sake, but also for my sake, because if she's exhausted, then she can't help me with anything, and or is less able to.
Hmm.
Than if she goes home and gets better rest.
Well, there's that fine balance too, and there's you have a spouse. It's two people, a balancing act, because I would imagine too that you had the surgery, your spouse is there, she's getting tired, you start worrying about your significant other. Well, that doesn't do any good for either one of you. So yeah, again, all the information that you're giving us is great. Things I haven't even thought about. Once again, for everybody out there, gettingbetterdoc.com is where you could go and you can find out more about Dr. Andrew Kadar, and his story and his book. And once again, the book is called A Doctor's Story of Resilience, Recovery, and Renewal. Uh, do you have a 30-second bite of what you would advise people to do pre being diagnosed with anything?
Well, I think that the advice about how to overcome denial is, if you have a symptom, don't think of it as your own symptom. Think of it as somebody else's. And what would be the best advice that you would give a good friend who said, I'm feeling this? And then you're not going to freak out over a little ache necessarily, but you're going to be realistic about it. And if you have the characteristic symptoms like I did, I would never have ignored the symptoms I had in anybody.
That's
Never.
perfect advice. In fact, I'll throw in that this is the opposite of what we have heard and said. This will be do unto yourself as you would for others.
Exactly.
Let me ask you something fun before we close out. Are you a movie buff or are you a moviegoer? Do you enjoy movies?
Yeah, of course. They're
W-
fun.
What was the last movie you watched? And is there a movie out there that you want to see?
Gosh.
It's a tough one, isn't it?
It is, because I'm usually busy and I haven't been to a movie. I've been watching the Olympics lately.
Okay. Oh, let me ask you this. Chitty Chitty Bang Bang, the old and original. Are you a fan of that?
Yeah, it's fun. I like comedies mostly.
I just had to throw that in there because it is difficult to pick something out when somebody just throws out, "Hey, what's that favorite movie of yours?" Like, I don't know. So,
I like a lot of old comedies and all the silly comedies. That all the Chevy Chase stuff is fun. Uh, oh, Eddie Murphy and all the Beverly Hills Cops movies.
that's right. Yeah.
And he just did one recently.
Yes. Well, there you go, folks. Go out and watch Fletch with Chevy Chase, right? And throw in a little bit of Beverly Hills Cop, the original. Dr. Kadar, this has been fantastic. I've really enjoyed our conversation today. And I'm going to say thank you for writing your book. So it'll make many of us aware of what we can possibly expect and what to do.
Well, thank you. It's a pleasure chatting with you.
You're welcome.